It engages its core and it lifts the acid up onto the squamous mucosa. And it's no different of how much it does that between a trot and a gallop. And it's only when the horse goes back to a walk for about 15 minutes that the acid settles back down. So it's our duration of exercise that's important, more so than our intensity of exercise. And when we say duration, we're talking about an average of around 30 to 40 minutes per day at a trot or above. So it's a significant amount of exercise where we start to see the risk threshold change. And like most things, moderation is okay. It's excesses that start causing risk when we think about carbohydrates, when we think about exercise. The other thing that's really important is our timing of exercise. So remember, we looked at our horses' eating behavior overnight. Those horses naturally overnight don't eat much. They naturally fast, they naturally rest and sleep. What that means is that roughage ball in the stomach disappears. And if we exercise those horses with no roughage ball, we're going to get a lot of acid splash, and that acid's going to splash around. When do we see this? The poster children for this are racehorses that exercise first thing in the morning. The other time we see it is, say, Florida, Texas, Queensland in the middle of summer. I grew up in Victoria, northeast Victoria in the middle of summer, basically anywhere in Australia in the middle of summer. We want to ride first thing in the morning because it's cool. It's nicer for us and nicer for the horse. But if we do that and the horse hasn't had a chance to eat and restore its natural protective mechanisms, we're going to increase the risk of squamous disease. So what we need to do is make sure we break that overnight fast. Alfalfa can be very powerful for this. Get it in, get that roughage, get that chewing. A flake or biscuit of alfalfa is going to make a big difference. And that's what we're looking at here on the right is a pH trace of a horse's stomach where it's sitting there at a low pH of about 2, and that's just food that's doing that peak. It's not, this horse is not getting drugs. That's just the impact of eating a meal of hay twice a day and grain twice a day. These horses have been fed like race horses. So if we exercise that horse after we've fed it, particularly after we've fed it hay, there's no acid in the stomach to splash around, then we're going to reduce our risk of squamous disease. So we put these together. We're trying to get greater than 2% body weight per day, less than a gram per kilogram of meal, less than 30 to 40 minutes cumulative exercise per day. Doesn't mean we can't exercise longer on individual days. It's a cumulative effect. That's going to reduce our squamous disease risk. And this is where we end up. This is our horses. Every time we go to a horse show, my teenage daughters, the first thing they do is they grab the hay nets, or at least these hay bags, and they make sure the horses have access to roughage as soon as we get there and up to the point where we leave. I don't actually feed them during transport. That maybe is a question and answer type topic. I worry more about setting them up and then fixing them at the other end than I do about whether they get hay during transport, primarily because I don't think they actually eat much of the hay during transport. They tend to just throw it around the horse truck. Okay, let's go to glandular disease. Glandular disease, when we talk about risk factors, all of those things we've done are good for squamous disease. They're good for hindgut disease. They're good for welfare. But they're not going to primarily address our risk of glandular disease because glandular disease is not primarily a disease of diet. So unless we're setting a bomb off in the stomach with ridiculously high levels of carbohydrates, changing diet's not going to make a big difference to glandular disease. That's not to say we shouldn't if we have high carbohydrates, but it's not going to be our primary driver of glandular disease. Omega-3s might be beneficial. It's inflammatory gastritis, marine-derived omega-3s might be beneficial. We don't have a lot of evidence for that.